President William Ruto has called the bluff on a section of governors allied to the opposition for supporting the ongoing doctor strike, saying the demands made by the medics are financially unattainable for the government. Health Cabinet Secretary Susan Nakumicha has also blamed the doctors' union, KMPDU, for playing hardball and disregarding court orders to return to work, as reported by Bridget Ngana.
I've been wondering, actually the morgues are full now.
Appearing before the Senate to answer questions on the state of health in the country, Cabinet Secretary for Health Susan Nakumicha absolved the national government of any blame, saying it had met its obligations on the 19 demands being made by health workers' unions over the implementation of the 2017 CBA that has seen doctors striking for more than a month now.
I want to plead with the doctors that if they respect the court orders and suspend the strike, they will create a very good environment of being listened to, and even the government also moving forward so that we meet somewhere with the doctors.
The CS says that the government needs to comply with the recommendation of the Salaries and Remuneration Commission, even as it seeks to meet the demands of health workers over salary increments, promotions, and employment of medical interns.
The people who raise the issue on risk allowance is the clinical officers. And they're saying they want the risk allowance to be enhanced from 3,000 shillings per month to 15,000 shillings per month. Honorable Speaker and honorable members, that is 500% increase in the risk allowance. That is an issue of budget.
President William Ruto, on his part, says there is no room for bargaining with the striking doctors, despite some governors seemingly sympathizing with the medics.
You have leaders who it is in their place, including governors, saying we support the doctor strike. Really? If you support the doctor strike, pay the money they're asking for.
And therefore, I would want to challenge the president that he should live to the promises he made. These were problems that were there before. They were not resolved. Some of them are historical problems. At the time, when he was not occupying that high office, he made statements to the effect that the Kenya Kwanza government would find it easy to deal with the problems like these.
The Employment and Labor Relations Court on Wednesday ordered KMPDU to call off the strike, but the union maintains that the 2017 CBA has to be implemented, even as patients seeking medical services at public hospitals across the country continue to suffer. Bridget Ngana, NTV, Nakuru.
President